Good morning. Good morning, everybody. Thank you for being here this morning. We're here to call attention to a very serious problem, and one that is something that it's easy to do something about, but it will be very far-reaching, the results. I'm proud to be joined by senior health and consumer advocates to discuss this important patient-centered prescription labeling in the state of California. Too many of our seniors and people with limited English proficiency have taken incorrect dosages because they can't read or understand the labels on their prescription drug bottles. Medication errors are among the most common medical errors, harming at least 1.5 million people every year, and in some cases leading to death. According to the Journal of the American Medical Association, 46% of adults cannot understand the information listed on their prescription drug labels. The statistics are glaringly clear. It is time that in California we establish protections for our vulnerable populations. In 2007, I authored and the governor signed SB 472. This bill authorized the Board of Pharmacy to establish patient-centered prescription drug labeling in California. SB 472 also required public hearings before the board so they could establish regulations. The board took public testimony from consumers and advocates and experts who laid out very clearly the terms and what protections were necessary to make an impact. While the Board of Pharmacy staff originally suggested regulations requiring 12-point type, the proposal was reversed after a newly appointed commission member representing the industry changed the direction of the outcome. The final version of the board's regulations require 10-point type unless a customer requests a larger size. Their proposed regulations only require the 12-point type when a customer requests that larger size, and only to provide interpretive services if those services are available. I think we all know what that means. It doesn't go far enough and won't make the difference we're looking for. The final regulations passed by the Board of Pharmacy last Thursday fly in the face of a good faith agreement with the board to use the facts gathered at the public hearings to guide the decision, and this violated the spirit of the original bill. It baffles me to know the board could so coolly dismiss the testimony of the experts while embracing the wishes of industry. During one of the public comment periods, the board received 1,161 letters. 1,159 letters were in opposition, while 2 were in support. Not surprisingly, the 2 positive comments were from the industry. The public outcry fell on deaf ears. And what kind of message does that send? The board had an opportunity to set a national standard for consumer protection. Instead, they demonstrated that they're not up to the task of protecting consumers in a meaningful way and have shown that they're willing to put the industry interests first. Today, I will be amending Senate Bill 1390 to include the consumer protections that were originally presented by the board that represented public testimony. SB 1390 will require that pharmacies provide translation services to patients with limited English proficiency, either in person or through a third-party translation service, which is available in many pharmacies today. Many pharmacies Many pharmacies have this, and it's time for the stragglers to come on board. Over 42% of Californians speak a language other than English at home, and of these, 47 report that they do not speak English very well. SB 1390 will require pharmacies to print labels in at least 12-point type. The industry average of 9-point font on labels used by seniors with vision impairment does not work and is unconscionable. These changes will have a big impact on California's most vulnerable populations, and studies show that they may save our state money by avoiding costly trips to the doctor or emergency room to remedy these medical errors. I urge my colleagues in the legislature and the governor to embrace these common sense consumer protections. For many Californians, this is a serious matter of life or death. The longer we wait, the more people will suffer. I'm pleased now to introduce some of the advocates who have been fighting the good fight as this measure moved through the legislature and through the Board of Pharmacy. And they're here because they feel it's important to protect California seniors. With me today are Ramon Casablanc, he's a member of the California Board of Pharmacy. Betsy Imholz, Special Projects Director with Consumers Union. Chuck Walker, a representative for the California Alliance for Retired Americans. Martin Martinez, Policy Director, California Pan-Ethnic Health Network. And Anthony Wright, Executive Director of Health Access California. And I will ask each of you to reintroduce yourselves as you come to the podium. Ramon?
Thank you very much, Senator. Ramon Casablanc, Board Member, California Board of Pharmacy. I've been extremely disappointed by the action of the Board over the last year. We have been given, as the Senator pointed out, over 1,000 letters supporting larger size font and supporting languages that Californians speak all across this state. We have heard from experts. We have heard from the leading academics in the country. We've heard from the National Association of Boards of Pharmacy. We even got a letter of support for 12-point font from the Director of the Department of Consumer Affairs. The only opposition that we had throughout this entire process came solely from the industry of chain drug stores, and it is a shame that just a few people like that could overrule the overwhelming turnout of opinion from Californians. It's high time that we listen to Californians, that we listen to experts, and I thank the Senator very much for keeping this fight going. We will get readable labels here in California.